So there's an area that's in charge of the rhythm in the top part of the heart called the sinus node, sort of our own built-in pacemaker. When it sends out a signal, it sends out one dominant signal to trigger the whole top part of the heart to beat in unison. What atrial fibrillation is that pacemaker area is thrown out of control. So instead of having one dominant signal, the atria, the top part of the heart, now has 500 or 600 signals that sort of work independently. Those 500 or 600 chaotic signals don't all make it down to the bottom part of the heart. They get down intermittently, so people will feel their heart skipping because some signals get through, some don't. The symptoms for atrial fibrillation are very subjective. We have patients with atrial fibrillation who have no idea that there's anything wrong. And then we have other patients that feel every 10-second episode of AFib. They feel their heart flutter, they can't function, they get short of breath, they have chest pain. The main diagnosis is really from an EKG, electrocardiography, and monitoring. We used to have the patient wear a Holter or a 24-hour monitor, which we progressed to like event monitors, which we can go for a week or two. But in this day and age, you can get it from your watch. There's a device called a Cardia that you can put on your phone. The patients can monitor themselves. So I tell my patients all the time, it's like you have high blood pressure or diabetes. That's your diagnosis. You're always going to have that. We're going to treat it so that there are no ill effects of it for you in the future. But that's your diagnosis. It never goes away. If you're in atrial fibrillation and the top part of the heart is quivering, no longer beating normally, not all the blood is going to be pushed from the top to the bottom. So blood may, quote unquote, hang out, stagnate, and form a clot. If that clot forms and is pumped out of the heart, it may go anywhere, but the worst place it can go is the brain, so you're at risk for stroke. That is the worst consequence of atrial fibrillation, so that's why you need to get it under control.